It's 8:30 now as we transition into our 8:30 high beam this morning, and we are privileged to be joined today by our guest, Cleveland Clinic Union Hospital Chief Medical Officer, Dr. Cody Turner. Dr. Turner, good morning. How are you?
Good morning, Brad. Thanks for having me this morning. I'm doing well.
It's our pleasure to have you on for unfortunate reasons, I guess, although we'd have you on anytime. But at this time, one of the reasons that we wanted to have you on is to discuss what has become, again, a big problem with rising numbers of COVID-19. I assume it's primarily different strains from what we had last spring, but tell us about the trends right now and kind of where we stand.
Yeah, and I guess, for context, I'll just give a little brief background for your audience. So, in addition to being the Chief Medical Officer for Union Hospital, my background is I'm a critical care doctor. So I've been practicing intensive care medicine for 7 years now, have been kind of all over Northeast Ohio. I've practiced at SUMA, I practiced at Mercy Medical Center prior to joining the clinic. And then prior to coming here, I was at Hillcrest Hospital on the east side of Cleveland. So I've kind of dealt with this both from the clinical side and from the administrative side. What we're seeing at present, unfortunately, is a significant surge throughout Ohio. As I'm sure most people are aware, about a month ago, Florida was hit very hard. We do have multiple Cleveland Clinic hospitals in Florida as well. There was a period of time that one of our hospitals in that area, which is a 350-bed hospital, had more than 2/3 of their hospital filled with COVID patients.
Wow.
And this is, directly attributable to what people are seeing in the news. More than 90% of the patients that we're currently seeing are patients with the Delta variant.
Yeah.
Now, clinically, we don't see that, when I'm seeing patients at the bedside, but that's extrapolated and, accounted for in the state data, and that's a statewide trend. So the thing about viruses is they get smarter, they mutate quickly, and so these variants will continue to happen. That is something that we can expect to continue.
Not just with this flu virus, but with all of them, right? They all do that.
Yeah, but you're right, and this is, coronavirus, a little different than the flu virus, but yeah, similarly, that's what viruses do. They mutate, they get smarter. We see it with seasonal influenza. That's why there's a yearly flu vaccine. We've seen it with coronavirus already, and we can expect to continue to see that as well. And that's why I actually, I had reached out to multiple people because my goal is to get as much information out as possible for the community. As I'm sure, your audience and everyone is aware, not only do we have a pandemic right now of a virus, but we have a pandemic of misinformation. And there's a lot of bad information that's been put out. If you're getting your news from social media, the thing to remember is that social media sites, their entire existence is predicated on keeping you on their site as long as possible and selling ads.
Right.
And so what that means is whatever information you're interested in seeing is what you're going to continue to see. I'm trying to provide good, sound medical information for the community. As far as an update with what we're seeing at Union Hospital in particular, as of this morning, we have a total of 76 adult inpatients in our hospital, and of those 76, 38 are COVID positive. So we have a 50% positivity rate in our hospital. That is the highest of any Cleveland Clinic hospital in Northeast Ohio with regards to percentage of our total beds. Currently, 80% of our ICU patients are COVID positive. And this is something that we've seen as a trend really over the last several weeks. I actually did my first clinical week in the ICU here at Union Hospital in the middle of August. And for context, at that time when I started the week, there were 2 patients in the ICU who were positive for coronavirus. And by the end of that week, there were 7. And it's kind of continued the trend from there.
Yeah.
Another great example is I'm looking at a spreadsheet right now with our data for Union Hospital for the entire month so far. And we've had, in the month thus far, we've had 1 ICU bed available 3 days this month. What that means is, generally speaking, we have been operating and starting each day with no ICU beds to put an additional patient in. That is not sustainable for a health system. When we have 1 ICU bed, what we use that for is what we call a crash bed. What that means is if we have somebody, on one of our medical floors who has, an acute change in status, needs to be put on a ventilator, has an acute stroke, has an acute heart attack, those things, that's what we would move patients to an ICU bed for. As you can imagine, not having an ICU bed to put those patients in is not ideal.
No.
Now, we do have backup plans in place in that scenario, but that's one of the other big things that we're dealing with right now is not only do we have an incredibly high percentage of our patients positive with COVID, but the health system in Ohio, not just at the Cleveland Clinic, but throughout the state, is inundated again with COVID. And what we're dealing with is not only are we seeing a lot of people, unfortunately, dying from coronavirus, but going forward, the other thing that we're all worried about, and I'm sure lots of people have seen in the news, is as hospitals and emergency departments and intensive care units become more and more overwhelmed with coronavirus again, that impairs our ability to take care of other medical conditions, things like heart attacks, things like strokes, like traumatic injuries, where the goal is to treat those patients very quickly. When the system is already bogged down with these other patients, that becomes difficult, if not impossible.
Right. We're with Cleveland Clinic Union Hospital Chief Medical Officer Dr. Cody Turner. Go ahead. I just wanted to ask you, what are some options then for having the general public to help decrease these numbers of COVID cases?
Yeah, and so that's the main reason I came on today. The single best way that the community can help, healthcare providers, the healthcare system, and their own community at present is to get vaccinated. The thing to realize is, you'll hear people say it all the time, and it's true that getting vaccinated against coronavirus cannot 100% prevent you from getting coronavirus. But the really important point that people need to realize is that when you get vaccinated, the risk that you will become severely ill, hospitalized, require ICU level of care, or die from coronavirus goes down dramatically. The risk that you will die from coronavirus if you are vaccinated is nearly zero. I have not seen a single patient yet at the Cleveland Clinic who was fully vaccinated who has died from coronavirus. A really great example in this hospital in our community, when I was in the ICU, I had a patient who was unvaccinated, whose wife was vaccinated. Unfortunately, the patient came in positive with coronavirus, was very ill. Ultimately, I actually had to transfer the patient to Cleveland Clinic Mercy Hospital for a high level of care for what's called prone positioning, where we flip patients over on their stomach when they're already on the ventilator and we aren't able to meet their oxygen needs.
Mm-hmm.
And unfortunately, he did continue to get worse and ultimately died. The other great irony is that his wife actually also became positive with coronavirus, was fully vaccinated. The difference was that she was home and, had essentially cold symptoms. And that's, the perfect illustration of the difference people need to understand. The patient was unvaccinated and ultimately died from his illness. And the patient's wife is alive and still here with us.
And all of the variant vaccinations, no matter who has produced those, are equally effective. Is that what you've seen?
Well, so with what we're seeing so far with Delta variant, certainly there is some emerging data on kind of, on ongoing variants, things like the new variant, Lambda variant, so on and so forth, where there is some concern that the vaccines may be less effective against some of the emerging variants, which again is to be expected. This is what viruses do. They get smarter. They become resistant to the things we do. That's why you'll hear people talking about things like booster shots. Will this become an annual vaccine? It's too early to know with certainty. At present, the booster shots are really recommended only for patients who are immunocompromised. So people on things like chemotherapy, on immunosuppressive drugs, those patients are recommended to get a booster. I suspect in the near future that's probably going to extend to healthcare workers as well. And it's not out of the realm of possibility that will also extend to the general population. There is no, set date for that, and that's more my opinion than, something that I know factually. That's just kind of something to be aware of.
Is there any idea, and I know you can only guess, how long this rise in cases would be expected before we finally kind of crest and head back the other way?
Yeah, so Brad, that is a great question. Actually, I was at the local Dover New Philly Kiwanis Club yesterday and spoke about this, and somebody asked that same question. The truth is we don't know. The Cleveland Clinic is very, very good about collecting data, following trends. Obviously, with this, surge of the Delta variant hitting Florida first, we can kind of extrapolate some of that data. Mm-hmm. I guess the good news, if there is good news, is because the Delta variant is more virulent, meaning that it makes people sicker, and because it's more contagious than the earlier strains, what we've seen is that it tends to come on rapidly, peak more quickly, and start to dissipate more quickly. That doesn't mean less people will get sick. What that means is more people get sick in a shorter period of time, which again is where we worry about overwhelming the health system.
Yeah.
In Tuscarawas County, as of when I looked yesterday at the data, we currently have a vaccination rate of eligible people, which is, age 12 and up, of 40% in the county. If you break that down by age, those over the age of 65, it's more like on the order of 70 to 80%. And if you look at patients, under the age of 30 or people in the state, it's more on the order of 25%. It's really important that people understand, I see it all on social media and elsewhere, that people understand just because you're young, just because you have a good immune system, does not mean that you can't get sick, and it does not mean that you can't die. I took care of a patient in his 20s at Hillcrest Hospital on the east side of Cleveland a few weeks ago who had no medical problems, unfortunately was unvaccinated, became severely ill, and ultimately died. So this is a very real possibility. That's not to scare people, that's to be honest. Being young does not prevent you from getting ill. Viruses don't care about your age,
right?
What your political beliefs are, what you believe about vaccines. That's not what viruses do. And so it's really important that people really think about it and really consider getting vaccinated. I'm talking to anyone who will listen, pleading people in our community to get vaccinated, because the fact that we have a very low vaccine rate is also contributing to what we're dealing with right now.
Well, Dr. Turner, I certainly wish you the best in getting the information out and then treating people who ultimately do get COVID-19 or anything else. And thanks so much for your time and joining us this morning. Again, maybe we can follow up with you in a few weeks and see where we stand as we continue on this. All right?
Yeah, thank you, Brett. I'm happy to talk at any time.
All right. Thanks so much, and we'll talk to you again. Again,
have a great day.
Thank you. Cleveland Clinic Union Hospital Chief Medical Officer Dr. Cody Turner joining us this morning on our 830 High Beam.